Hi, everyone, and greetings to all of you who are joining us from different parts of the world today. I'm excited to welcome you to this month's live public webinar of Global Action to End Smoking. I will now call Mr. Eric Augustin from Global Action to End Smoking for his opening speech. Eric?
Well, thank you, Asena. Good morning, afternoon, and evening to everyone. On behalf of Global Action, I'd like to extend a warm welcome to today's webinar. As Asena mentioned, my name is Eric Augustin. I am the Vice President of Programs here at Global Action, and although I'm relatively new to this organization, I do have a 25-year history in tobacco control, ranging from clinical settings all the way up to federal government settings within the United States. The public health and economic impact of combustible tobacco use is well known to this audience. We are all in the business of trying to figure out how to help smokers quit the use of combustible cigarettes and other dangerous tobacco products. Helping people change behavior is always complicated and difficult, especially when that behavior involves an addictive product. Although a crucial core element of increasing sustained smoking cessation is effective treatments, those alone will not get us to where we want to be in reducing the burden of combustible tobacco use. There has to be motivation to engage in those treatments and a social context that supports quitting smoking. A foundational component to creating that context relates to tobacco control policies. Although still complex, the policy and regulatory environment was relatively straightforward when there was a clear set of highly dangerous tobacco products to target. With the introduction of a whole new class of products, the reduced risk products, the policy and regulatory landscape has become much more complicated. Although these products offer great potential to reduce the burden of combustible tobacco use, they are also poorly understood by many, many individuals within this sector. Optimally, governments would be creating markets in which traditional tobacco products are disadvantaged compared to reduced risk products. However, as you all know, this has rarely been the case, and tragically, we are seeing markets across the globe where traditional tobacco products are receiving the advantage over reduced risk products due to policy decisions. Thus, there's a strong need for health economics research exploring the intended and unintended consequence of the policies and regulations that have emerged with reduced risk products. And that is where you all come in. As you know, under IDA's leadership here at Global Action, we've been organizing public health webinars to share economic research on consumer behavior, perceptions, and beliefs specifically on reduced risk products, especially how current regulatory and social environments have been shaping these behaviors, perceptions, and beliefs. Our focus is on providing evidence-based insights to scholars, public health communities, and other stakeholders in developing countries where the burden of tobacco-related harm is the most significant. Today, we are extremely privileged to be hearing from distinguished scholars in Nepal who will present research on the factors influencing smoking cessation intention and responses to potential health regulations. This study contributes to our understanding of consumer behaviors and offers valuable insights for many stakeholders in Nepal and beyond. One of our priorities at Global Action is to foster North-South and South-South collaborations. Today's webinar is a testament of this commitment. Our moderator, Asena, is from Turkey and is part of those South-South networking efforts. And additionally, Nepal scholars have established North-South collaborations with distinguished scholars from Cornell University in the United States. I'm quite excited to hear from the Nepalese scholars and believe their research will provide valuable insights into the evolving tobacco landscape. Without further ado, I'm going to turn this back over to Asena, who will welcome our distinguished speakers. Thank you.
Thank you so much, Eric. So let me introduce myself. As Eric said, my name is Asena Caner, and I will be the moderator for today's webinar. I'm a professor of economics and also the executive director of the Economic Research Agenda Association, which is an NGO based in Ankara, Turkey. and my research interests lie in development, education, and health economics. Today we will be together for about an hour and listen to my colleagues from Nepal who have done some great work on smoking and vaping behavior in Nepal. As you know, Nepal is an emerging economy strategically located between two of the world's largest economies, and I think their findings will provide valuable insights. So I'm looking forward to hearing their talk. I also hope that today's presentations and discussions will capture your attention and highlight the importance of this policy-relevant topic, which lies at the intersection of economics and public health. And we do hope that you will participate. As you listen to the webinar, please feel free to share your questions and comments by clicking on the Q&A button and typing them in for us. We will do our best to address them either in writing or orally. Thank you in advance for your participation. And now let me introduce today's presenters. Mr. Trilochan Pokharel is the Senior Policy Advisor at Prakriti Pragya Nepal, shortly PPN, a Senior Faculty Member of Public Policy at the Nepal Administrative Staff College, and a visiting faculty member at Nepal Open University and Yamaguchi University in Japan. He's the team leader of the research project Economics of THR Products in Nepal, funded by the Global Action to End Smoking. And with over 2 decades of professional and academic engagement in public policy, public sector management, and governance in Nepal and South Asia, Mr. Pokharel has led numerous research projects in public policy, public sector reform, and tobacco economics. He provides policy advice to the government of Nepal and offers consulting services to national public organizations, international development partners, universities, and civil service colleges. For several years, he was a faculty member at Tribhuvan University and Pokhara University. He holds a graduate degree in economics and an MPhil degree in humanities and social sciences from Tribhuvan University in Nepal. Dr. Nirmal Kumar Raut is a postdoc research fellow at the University of Tokyo and is currently on study leave from Tribhuvan University, Nepal. He's an associate professor of economics at Tribhuvan University and a senior research fellow at PPN. His broad research areas include development, behavioral, and health economics. And at PPN, he focuses on the economics of THR products in Nepal, using discrete choice experiments to elicit consumer preferences for THR products. And our third speaker today will be Ms. Nisha Thapa, who is the research officer at PPN, a graduate of economics from the Central Department of Economics at Tribhuvan University. She is interested in market and consumer behavior research. As an emerging scholar, she has experience in conducting survey research with a focus on consumer behavior and meta-analysis. She served as a research officer on the project, The Economics of THR in Nepal. Now, Trilochan, I know that you have conducted surveys to study the quitting behavior, more specifically, the quit intentions of smokers in Nepal. Who intends to quit smoking tobacco in Nepal? Please tell us about it.
Thank you, Asna, for this sweet introduction. So let me share my screen first. Is it okay? Okay. Thank you. Thank you for this very sweet introduction and also very comprehensive introduction. So basically, what we'll be doing today is we'll be sharing 2 of our research paper research finding out of the large research. So the first one I'll be speaking on who intends to quit smoking. Insights from a survey from adult smoker in Nepal. So this study is funded by the Global Action to End Smoking. Formerly it was Foundation for Smoke-Free World, and also We have received a lot of support from different scholars. Especially, we are thankful to the Cornell professor, Professor Ken Kell, and Professor Matthews for their instrumental support throughout this research. So without their support, I think we would not have done this research to this extent. So basically what I'll be doing in this presentation is I'll be briefly introducing the context and the purpose of this study and certain hypotheses, how did we have concluded on those hypotheses and the study methods and certain results and conclusion finally. So as Asana, she has introduced Nepal, and so it is located between the world's two big economies, China and India. So they are not only large in terms of population, but they're also a growing market or a growing they have large consumer base in tobacco. So there are certain figures that for everyone's reference, I want to reiterate here, although they are not new. So we know that nearly 1/3 of adults, they smoke daily. It's a global data. And it's like almost 8 million deaths they are caused by tobacco annually. So when it comes to Nepal, so for Nepal, around 27,000 deaths they are caused by tobacco-related causes, tobacco-related disease. And we also understand quitting is the most effective way to prevent this harm, as Eric had said in his opening remarks as well. So we also have seen almost 75% smokers, they want to quit, but certain addiction and relapse, and it makes it difficult for them. So we wanted to know what could be the alternative ways to support this population. And so 2/3 of smokers were interested in quitting, with almost 50% making quit attempts annually, but the success rate is relatively low. So in this context, so we have done this study, and then again focusing to Nepal particularly. So as of now, also we see around 30% in percent people, they use some sort of tobacco, any sort of tobacco. And if you look at the average age of initiation, it is almost 18%, 18 years, or less than 18 years. And for male and female, we see a differential this ages for initiation. And in South Asia, maybe it is for other developing countries as well. So there are two different trends for combustible tobacco and other smokeless tobacco. So in these countries, the smokeless tobacco is emerging as one of the public health issue, as one of the public health problem. But again, the smoking combustible tobacco, and that proportion is still that is relatively high. And we also have seen the average monthly cigarette consumption in Nepal is, for an example, it is almost 150 cigarettes, and we cost around 1,000 Nepalese rupees. It's around $8 to $9. And if you compare this with the per capita income of this country, so we think relatively high expenditure. Also, we see the quit attempts in the past between 2013 and 2019, so it has decreased from 26 to 19%. But after that, the quit attempt, the recent studies of the service they have captured, that is relatively low. And also the health advice to quit smoking, that remains stagnant at around 22%, and it has not gone further than that. But on a positive side, we have seen a decline in tobacco consumption trend. So from between 2001 to 2022, so it has decreased from 45% to 28% for male, and for female, it has decreased from 25% to 5%. But still, there are many other issues that we have to bring on the table to discuss how this public health issue can be addressed. So these are the basic statistics. How is the tobacco the consumer behavior in Nepal, and how it is one of the very pertinent issues to be addressed by the global community. So when we go to the studies in Nepal, there are a number of studies, and they are taking place in Nepal, but particularly they are related to the smoking behaviors, or quit intention, or perceived health risks, or health warnings, or nicotine dependence, and recently the issues of e-cigarette that has been introduced and the cessation practices, they have been studied by numbers of scholars. But when we go through these all analysis, we still are unaware about what are the specific factors that actually drive the smoker's intention to quit in Nepal. That remains unclear. So this study could be one of the important insights in that respect as well. So in this backdrop, we thought that it is useful to study about what are the factors actually, like factors such as the nicotine dependency, cessation advice, vaping habits, health risk beliefs, exposure to graphic health warnings, price increase, past quit attempts, and certain demographic variables. How do they influence smoking intention or the quit intention in Nepal? This quit intention is something like that. It is like reported quit intention that the smokers they are willing to quit in next 6 months or so, like in relation to the survey period. So this is but this survey this presentation is based on a large part of survey. So we have taken only one specific what is a component of that survey, and we wanted to see what are the actually the factors that factors or the variables that influence the intention of smokers for quitting. So we have set 8 hypotheses based on the literature review, and then we have tried to test using our data. So I will first go to those hypotheses briefly and then come back to the survey methods as well. So the first hypothesis is to see where the no, the relation between nicotine dependence and the intention, quit intention behavior. So the research of the literature it says that the lower dependence is linked to higher quit success. It means if the smokers they have the lower nicotine dependence, it is likely that and their quit intention is higher. So as the nicotine dependence increases, the tendency or the consideration decreases as well. So the first hypothesis here becomes like those with higher nicotine dependence are less likely to consider quitting. So we will test later. The second hypothesis is about the smoking cessation advice. So we have seen like advice from healthcare professionals that increases quit attempts. So we wanted to see that receiving smoking cessation advice increases the likelihood of quitting, whether it holds true or not for the case of Nepal. And third is the e-cigarette add smoking cessation, but evidence is mixed. So that is what the literature says. So it has a mixed response as of now. So we want to see whether the belief in e-cigarettes as a quit ad increases quit intention. And then fourth hypothesis is about the health risk perception. So smokers who perceive higher health risks, whether it motivates them quitting or not. So the fourth hypothesis is about perceiving smoking as health damaging increases the quit intention. And fifth hypothesis about the graphic health warning. So in South Asia, so Nepal has introduced one of the stringent, graphic health warning policy. Almost 90% of tobacco products, the package that would be covered with some sort of health graphic health warnings. So we wanted to see whether those warnings encourage quitting, or the exposure to graphic health warning increases, quit motivation. We want to test it. And another is the issue of price. So there are certain research, there are numbers of research they have said that if the price, price could be one of the mechanisms to discourage the smoking behavior. So we wanted to see whether the increase in price leads to higher quit intention. For that, we have used some hypothetical scenario. For an example, like when considering the different scenario of price increase, like 25% in current price, or the 50% in current price, and the 100% in current price. So what actually how it actually affects the intention of the smokers. Another hypothesis about the past quit attempts. So those who have made previous attempts to quitting attempts that actually increase future quit intention. So we wanted to see if the smokers they have made some recent quit attempts. So what does it predict the future intention of quitting as well? And finally, we also try to say, is there anything to say with the demographics of the smokers? Does the demographics of the smoker make any sense for their quitting intention? So for that, we have used certain variables like age, education, and gender, sex. So does it make any difference in the quitting intention? So these are the 8 hypotheses I'll be discussing later. So how actually our research supports or rejects this study, these hypotheses. So for that, I have used data from 2023 baseline survey on consumer awareness about tobacco harm reduction in Nepal, which is a part of the project Tobacco Harm Reduction Research in Nepal. So for this baseline survey, we have interviewed almost 1,540 smokers from different cities of Nepal. And this particular analysis is focusing on the quitting behavior only. So for this analysis, we have used outcome or as a dependent variable as intention to quit smoking in next 6 months of the survey. And for the predictors, we have used Fagerström nicotine dependence index, cessation advice, vaping habits, health risks beliefs, particularly the lung cancer, graphic warnings, exposure to graphic warnings and its impact, price increases, past quit attempts, and demographics, as I have said earlier in the hypothesis as well. So we have used binary logistic regression to predict this quit intention, and we have developed 3 different models. And in the first model, we have used 3 predictors such as dependence, nicotine dependence, vaping, health beliefs, and some other variables. And in second model, we add the past quit attempts to see the interaction effect across the models. And in third model, we add the demographics and to see how they have been reacting in a way. So this is the descriptive statistics we can see here. So if you go to like intention to quit smoking, we say out of those surveyed, almost like 50% they said no, and again another 50% they said yes, and they are thinking to quit in next 6 months. And for the Fagerström index, it is classified into 3 levels: low, medium, and high. And almost like 65% they are in low dependency, and then 22% in medium, and the rest in high. And smoking advice, for smoking advice, almost 30% they didn't receive any smoking advice, and 69% they received smoking advice. And this advice is not necessarily from only the health professionals, but it may be from the family members or friends or their peer circles. So it does not distinguish whether it is from the health professional or any other, but they have received some sort of cessation advice. And also the satisfaction with vaping. Those we have tried vaping. So we have asked a question that whether to what extent they feel satisfied with the vaping, and almost like 90% they said no, they are not satisfied with vaping, and around 8%, 9% they said yes, we are satisfied. And smoking causes cancer, lung cancer. It is a knowledge question. So almost all, they said yes, it causes lung cancer, and around 2% only they said no. And the knowledge about smoking damages health, and the same thing, like around 66%, they are not aware, they didn't perceive, not necessarily aware, but they didn't perceive that smoking damages health. But around 34% they said yes, it causes. Like graphic health warning may feel feeding. So we have asked this question to those who have exposure to graphic health warning. And when they see, for example, question was asked in this way: if they see graphic health warning, how does it make them feel? And almost like 35% they said that it doesn't feel anything, or it doesn't like encourage us to feel feeling. And almost like 65% they said that yes, it encourages us or makes us feel to quit. And the price increase, I have already said you, like we have used 3 different scenarios: 25%, 50%, and 100%. And we haven't used like 25% and 30% and 50% in our analysis, but because when we were doing some analysis, we didn't see any impact of those variation. But this 100% price increase, it showed some sort of variation in our prediction. So we have returned this variable here. And attempt to quit smoking in the past 6 months, almost like 48% they said no, they didn't make any attempt, and another 52% they said yes, they have made some sort of unsuccessful attempt to quit smoking, because these are the current smokers. These are the current smokers. So those who have attempted quitting and then they have left smoking, so they are not included in our analysis. So let me come to the result here. Okay. Let me come to the result here. So I will go to all these hypotheses. So the first hypothesis, higher nicotine dependence reduces quit intention. Yes, that is supported in our read also. The nicotine addiction that lowers the likelihood of quitting. So if you have higher dependency, so that that reduces the quit intention. So people, they are already addicted, so it is hard for them to think about quitting. Which is true in other literature as well. So we also saw like access to cessation advice that increases quit intention. That is true. So if they receive any type of advice by anyone, maybe a professional or the peers or the family members, that increases the likelihood of quitting. And another interesting finding is that those who believe that vaping as a quitting aid, that promotes quit intention, and which is significant as well. So this question has asked to them who have ever tried any sort of vaping or e-cigarette, and we have asked them how do they feel about it, and then this is supported that if they consider, those who consider vaping as cessation, that positively impacts the quit intention. And satisfaction with vaping, that also increases the quit intention again. Those who experience their satisfaction, or those who are satisfied with the vaping, so they are more likely to report the quit intention in future. But that does not again mean that they uh, they intend to switch to vaping, or they want to quit smoking or any sort of smoking behavior at all. That is not known in this study, but it's some sort of impact or influence of vaping in quitting intention as well. Yes, and those who have awareness about health risks, that increases quit intention. Those who are aware of lung cancer risk, that correlates with the higher desire to quit, and they intend to quit in near future. And the impact of graphic health warning is significant in our model as well. So those who are exposed to graphic health warning and they feel some sort of influence of this graphic health warning, they intend to report quit in near future. But again, this does not mean whether this graphic health warning is creating knowledge in them or it is creating fear in them. This is unknown, but we see some high impact of graphic health warning in quitting intention in future. Likewise, we also see that higher price increase, cigarette price increase, that also motivates quitting intention. So again, I would like to remind here. So we have used the 100% price increase in this model. So the price hike that leads to higher consideration of quitting in future. And we also saw that past quit attempts also explains or also had some indication for the future intention to quit. Those who made attempts in past, they show higher higher future quit intention. And if we compare this odd ratio of hypothesis 6 and hypothesis 8, which is quite high, and we can see these factors are dominating in our model as well. But for the demographics, the influence of demographics, we are inconclusive. So we didn't find any like specific or significant influence in the prediction, but some sort of in some cases. So when we like decompose this analysis into some small groups, we find some sort of influences of this age, gender, and education. But education, and yeah, that is what we have seen. But age is like negatively correlated in quitting intention. So with the higher increase in age, so that is the like lower intention to quit. It's maybe we have to see from the nicotine dependence or the hypothesis one. So this is what our finding. This is our finding from this study. So based on this, we have made some conclusion. So I'd like to go to there. And I've also placed the our finding in this slide, which is again same thing I've already explained in earlier slides as well. So we see like smoking, it remains a major public health concern in Nepal, and the for different reasons, for health reasons, for economic reason, and for several other reasons. And we also saw like factors, there are certain factors they affect quit intention, like nicotine dependence, cessation advice, vaping habits, health awareness, graphical warning, and affordability, that means price, and also the past quit attempts and demographics. And we believe that understanding these factors actually help design effective and targeted intervention to save lives, to save public health issues, and to reduce the burden of smoking. And the stakeholders may use these insights to support public health initiatives for reducing the burden of smoking in Nepal and also in public health economics. So it can be a like good starting point for that. So Athena, I would like to stop my sharing here. And there are certain questions I have seen, so I'll try to respond when we will progress to next presentation.
Thank you, Tirilo Chan, for the great presentation. Very interesting results. Great work. Now let's move on and turn to Nirmal and Nisha for their presentation. So PPN has conducted a survey that included a discrete choice experiment, shortly DCE. And they have analyzed the DCE data to examine the factors influencing consumers' choice between smoking and vaping. Please tell us about your findings. The floor is yours, Nirmal and Nisha.
Hello everyone, I'm Nisha Thapa, and today we will be presenting the results from discrete choice experiment among the adult smokers of Nepal. So can we go to another slide? Yeah, so the disclaimer, Mr. Trilochan Pokhrel has already shed some light on the disclaimer. We can go on the other slide. So, smoking related health problems have been prevalent globally, and it accounts to the second largest cause of death in Nepal. There are various alternatives available in the market regarding the smoking health reduction, such as e-cigarettes, more commonly known as vapes in the market, nicotine patches, and gums. E-cigarettes have been gaining popularity globally, and yeah, similarly in Nepal, it has been gaining popularity, though it is a newer product in the market. Some studies have also shown that e-cigarettes can be better alternative to the traditional combustible cigarettes, and so in this context it is necessary to understand whether people are aware of such products in Nepali market, and whether such products are helping the smoking population of Nepal to quit smoking in Nepal. Can we go to the other slide? So, this DCE experiment was conducted with the objective of identifying the attributes that have affected that affects the choices of smokers regarding their choices in three different choices: cigarettes, vape, or e-cigarettes, and the option of opting out, and also to examine the preference of cigarette smokers towards vapes and e-cigarettes. So, for the further elaboration on how the discrete choice experiment was conducted and what results we got, I would like to invite Dr. Nirmal Kumar Raut on the floor. Thank you. Hello.
You are muted. Nirmal, you are muted.
Am I audible now? Okay, sorry about that. So yeah, thank you, Nisha, for starting with the presentation. So I'll be talking about the study area and the sampling plan that we adopted in this study. So this is the map of Nepal. So we selected 12 different districts across the country. So as you can see, these highlighted, areas, these are districts, and the green dots, they are the cities within those districts. So we selected 18 cities. So to the western side of the country, we had 4 cities. And in the eastern side of the countries, we had like 7 cities. And the rest of the cities we took from the middle part of the country, and including Kathmandu Valley, which includes 3 cities within Kathmandu Valley: Kathmandu, Bhaktapur, and Lalitpur. So we sampled these respondents, the smokers, based on the smoking prevalences in these respective districts. So we have altogether like 1,300 samples, to be very specific, 1,357 samples. And out of them, almost like 16% were female, and the rest were male. So we selected urban areas only, the city areas only, because these areas have some understanding, some awareness about the vape vis-a-vis, the rural part of the country. So let me talk about the methodology that we adopted and the empirical strategy. So the choice sets to come up with to fix the number of attributes and the labels in the choice sets. So we did preliminary market assessment first from the both supply side as well as demand side. So on the supply side, we went to to talk to the vendors of both cigarettes, combustible cigarettes, as well as vape and e-cigarettes. So we talked them about the prices, about the type of products that is in demand in the market. So we kind of also asked them about the type of customers, their age group, gender, and so on and so forth. So we had some information about these prices and several other attributes from these vendors as well. So on the part of the demand side, we just wanted to make sure that the information that we had from the supply side are consistent from the demand side as well. So we kind of conducted a group discussion, focused group discussion with the group of cigarette users and the group of vape users or switchers. So we inquired them about, we talked them about the prices as well, the type of products they would buy, and and what are the attributes they would prefer in those products, and so on and so forth. So we had this preliminary assessment of the market, and then after doing that, we did also kind of triangulate this with this information that we had from this market assessment with the literature review, and then we consulted with Cornell professors and fixed these number of attributes. So we finally came up with 4 attributes, which are price. They had 3 labels, and we have flavor also, like they have 2 labels, health warning, 2 labels, and strict enforcement of smoking ban in public places. So essentially, in Nepal, we have a ban in public places, but it is not strictly enforced, right? So we wanted to see what happens if it is strictly enforced, all right? So we wanted to make that variation in our experiment to see, whether strictly enforcing this ban would have any effect on the choices of the smokers. So in order to come up with the number of choice sets, so we use de-optimal design. We use the R program, and it generated 30 choice sets, and we divided the choice sets into 3 blocks. So as you know that it is really burdensome to the smokers if we present them with the 30 choice sets, right, to each individual, to each smokers. So we divided that into 3 blocks of 10 choice sets each, and they were colored differently so that they do not mix up, right? And then we also kind of, introduce some kind of variation across these blocks. So blocks A and B, so in terms of health warning, blocks A and B, they only had textual health warning information, right? Whether this textual health warning is present in the cigarette pack or in the vape pack or not, right? But in block C, what we did was something different. So we show them the real picture of this health warning, right? So that is the difference that we introduced in order to see if, people, if they visualize these health warnings in pictorial form, whether they have a, different response vis-a-vis when they see the choice sheet wherein health warning is presented in the textual form, right? So that is the kind of variation that we wanted to see. And then so far as the model is concerned, we use structural utility models wherein we estimated conditional and mixed logic models. And we also do the LPM model to look into whether, the cross effects, whether there are any cross effects across attributes of these choices or not, of these products or not, right? So mixed logic model, so we interpret it in terms of marginal utility, change in marginal utility. But when it comes to LPM models, we interpret it in terms of, probability of choosing, an alternative or choice, whether it is a vape or smoking or, other, or opt out or do not choose option. So we have 3 options, right? So this is the table which shows the alternatives, the attributes, and the labels. As you can see that for prices, we have 3 different ranges of prices for cigarette as well as for vape. So vape prices, we kind of try to, make it comparable with the price of cigarette. So we calculated price per puff for the vape, right? We assume that, 1 stick of cigarette gives like, 15 puffs, right? So we kind of accordingly calculated the price for vape also for 3 different ranges of, these products. Right? So availability of flavor, tobacco and menthol, or only tobacco in case of cigarette. For vape, 2 flavors available and many flavors available. And for the strict enforcement of ban in public places, whether there is presence or absence of these strict enforcement in both the cases for cigarette as well as for vape. And in case of warning, so whether these warning are present or not in these products. Right? So these are the attributes and the labels that we considered finally for the discrete choice experiment. So this is the choice sheet sample. So if you look into the first choice sheet, so this is a sample from blocks A and B, which have textual health warning for the for both cigarettes and vape. As you can see that we only just provided them information whether the textual health warning is present or not in those cigarette packs. So how is it different from, so how blocks A is different from these 2 blocks, A and B? So we kind of, introduced, the graph itself, the picture itself in block C, rather than, just showing them the textual health warning. So this is the difference that we have between these 2, between these blocks. So let me give you a brief overview of the descriptive stat. So if you look into the A's, so most are between 20 and 30s, all right? So these are mostly, college going students who have completed secondary level, education. So the male smokers are older than the female smokers. And in terms of frequency of smoking, you see that, everyday smokers, frequent smokers are largest. They account for more than 90% vis-a-vis, the smokers who smoke only, sometimes, right? And so far as education and income is concerned, it's kind of in, if you look into this descriptive stat numbers, so it's kind of inverted U-shape kind of relationship between smoking and these parameters, right? So the higher the education, the less the proportion of smoking, right? So so in case of small education, those who have completed secondary education, the proportion is the highest. But if you go to the higher education who have bachelor level or above, it reduces to 37%. And the same is the case with the income as well. You know, middle income consumers, smokers are the one who smoke the most. And then when you go you go to higher income bracket, the proportion actually decreases. So it's a kind of inverted U-shaped relationship between smoking and these parameters. For occupation, as you can see, salaried and wage earners and students are the ones who smoke the most. So let me move on to the next slide. So this is the result, descriptive results from the discrete choice experiment. On the left-hand side, so we see that almost like 55% of the respondent smokers, they choose cigarettes, right? And almost like 1/3, a little more than 1/3 of the respondent, they chose vape. So it is also a very significant number. So you can say that 2/3 and 1/3, 2/3 choosing cigarettes and 1/3 choosing, kind of vape. And there are some, sorry, so there are some who are also, not choosing anything, right? They do not choose option or opt out option, right? So when we divide the same, the responses by blocks, we do not see much difference when we divide it by blocks. The only difference we see in terms of, do not choose opt-out option, as you can see that block C, it had, if you remember, it had these graphs and a pictorial health warning, whereas block A and block B, they had this textual health warning. So we do not see much difference in numbers between the proportion of, smokers choosing cigarette and choosing vape, but we see that the largest proportion of these three blocks are choosing, almost 8% are choosing, to opt out of the choices. Right. And in terms of gender, what we can see is that out of male, the largest, sorry, the smokers, male accounts for the largest of these choices being made, right? So they choose to, they choose cigarettes. Most of the male choose cigarettes. But if you look into the female, the numbers, the proportion of female, so you can see, those choosing vape, right? So if you look into vape proportion, the females are the highest, right, than the male. So the female are choosing vape more than the male choosing vape, right? So this is, I think, a very interesting pattern wherein the female are showing preferences for vape more than the male counterparts. So this is the result of the choice model estimate. So the column 1 and 2, they show the conditional logit estimates, and column 3, they present the mixed logit estimates, results from the mixed logit estimates. So if you look into, for example, the coefficients on prices and the coefficient on strict enforcement of ban, across all models, they are negative and they are significant, indicating that they are robust in one way or the other, and they kind of have negative utility on the smokers, right? So increasing prices and strict enforcement of ban are very important to to reduce the smoking intensity, the smokers. For other, for flavors and for warning, the results are not very stable. It changes across, the estimates, as you can see that. But when we try to see whether, the blocking exercise has any differential impact on the choices made, so we do that by interacting the alternative specific constant of these respective products with, the respective blocks. So you can see that when we interact ask cigarette with the block C, so block C as already, let me again tell you that block C had this pictorial health warning, whereas block B and block A did not have pictorial health warning. They have textual health warning. So when you interact these two, you see that the utility actually, there is a negative utility from block C. All right, with regards to the cigarette consumption, right? We do not see the same in case of vape, right? And in case of multinomial logic model, again, what we do is that we try to, try to substantiate or, try to check the robustness of these, estimates in terms of, whether this blocking exercise has any effect on the choices. So herein also, if look into the dummy for block C, the coefficients are negative and significant, and it's more kind of the magnitude is higher in case of cigarette than vape, right? So block C. So visualizing these graphical health warning is important if you really want to, reduce the smoking incidence. And A's has a nonlinear relationship with these choices, with these preferences. So starting with the negative relationship. So when A's increases, the smoking or the utility decreases, and then after some point it starts increasing, right? And so far as the gender is concerned, what we see is that the preferences of female is a positive from the by choosing cigarettes and vape, but in case of vape, it is the magnitude is greater than in case of cigarette, indicating that the female are deriving more utility from the vape than the cigarette, although both of the coefficients are positive. So we do not find any significant effects for other covariates, so I don't explain them here. So we also do the LPM estimates to see whether there are cross effects across attributes. As you can see that the price of cigarettes, it reduces the demand for the cigarettes, of course, when the price of cigarette increases. But it also has, substitution effect in terms of increasing the demand for vape, right, or e-cigarettes. And the same is with the case of price of e-cigarette. So e-cigarette also, increases the demand for the substitute, that is cigarette, and decreases its own demand, all right? And looking into the strict ban, we see that ban on cigarette, it decreases the demand, but we do not see any increase in the demand for vape, although the sign is positive, it's not significant. But for ban on e-cigarette, we see that, it kind of increases demand for its substitute, cigarette, but decreases the demand for vape and e-cigarette. For warning and flavors, we do not see, and the results are still stable, so we are not sure about how to interpret the results. And we also do introduce the block B and block C dummies here to see, whether that, the differential effect still persists with this model. We see that, it really has the similar effect that we saw earlier, right, with the conditional logic estimates and mixed logic estimates. We show that, visualizing this graphical health warning, really has, negative effect on the choices of these products, right? So all in all, if you look into the no choice category as well, so these attributes really have an important, implications on these no choices. So if you look into, for example, ban, strict enforcement, prices, warning, they all have somewhat non-trivial sort of effect on no choice category as well. So they can be important for quitting as well. So let me conclude. So we show that both price and non-price attributes are important. So non-price attributes, particularly talking about the regulatory policy of strictly banning the cigarette. It's really important from both perspective, from revenue mobilization perspective, as well as from the perspective of improving public health. And what is important here, from the blocking exercise that we did, is that in Nepal, so we have this policy, we have these regulations that the retailers, the vendors cannot sell loose cigarettes, but they are selling loose cigarettes. That is why, that may be one of the reasons, because by selling loose cigarettes, the smokers, they do not they skip seeing, or they do not visualize this graphical health warning that is in the cigarette pack. All right, so if we strictly enforce the selling of cigarettes in packs, so it might be the case that the smokers would see that, would visualize that graphical health warning, and might help reduce smoking incidents. So with that, so I'll stop here. Thank you very much for listening to me.
Thank you so much, Nisha and Nirmal. Great presentation indeed. And we received some questions in the Q&A box, and they have been answered in writing in the Q&A box. So at this point, let me ask the audience if there are any further questions. If not, I will close the webinar. There is one question to Trilochan. The data shows a decreasing trend in quit attempts from 26% to 19% during this period. Was there any influence of changes in smoking regulatories during that period?
I think, Esther, I think this was the question that you have also raised, right?
You didn't see the question?
Yeah, I saw. I think this was the question
okay.
you have also raised, and then I've tried to respond there. Actually, we do not know the specific reason for this, but Nepal introduced, very stringent, anti-smoking policy in between 2011 to 2014. There could be some impact of that, but I'm not sure that why actually that decline in quitting intention is happening there. I'm not sure. I'm not in position to answer right now. Yeah.
And another question is asking who is using harm reduction products in Nepal in terms of age, education, gender perspective. Any insights on that one?
Yeah, our analysis shows that it is popular among the urban young adults, and actually those who are interested to switch from combustible tobacco to any other, like harm reduction product. That is what our analysis shows, and we have also tried to see, that is what we are trying to present as well. In Nirmal's presentation, also we are saying that like the age has some sort of impact, and particularly those who belong to young age, they have higher intention of selecting e-cigarette. And in our analysis baseline survey also, we saw the same trend. Those who are of young age and then are the urban resident and have exposure to these alternative products, they have higher intention, or their preference for these products. Yeah.
Okay, thank you. So as we have run out of time, it's time to now wrap up and close the webinar. I would like to thank everyone who joined us today and Global Action to End Smoking for organizing this webinar. I'd also like to invite you to our next webinar, which will be held next month on October the 25th. In that session, researchers from Turkey, where the import of electronic nicotine delivery products is banned, will present their findings on consumer perceptions and behaviors related to both combustible and non-combustible tobacco products. Without giving away too much, I'll just say that it's a webinar you won't want to miss. So let's hope to see you then. Have a great one. Bye-bye.
Bye.
Bye.